Welcome to Casting Light, everyone. I'm Jayla Mamadova, and today I have the pleasure to be speaking with Dr. Tolu Kehinde. Dr. Kehinde is a resident physician at the Mayo Clinic in Minnesota, a Nigerian native and graduate of the MBA program at Dartmouth. She's deeply committed to African agency and advancement. Some of her professional experiences include assessing a vaccination policy implementation at the Rwanda Ministry of Health, exploring the future of senior living in America, and creating the vision for African Leadership Academy's healthcare network, Alpha Health. Tolu, just before we were starting off, I told you just reading your background puts some of us to shame. And it is, again, thank you so much for joining today.
Thank you. It's a pleasure to be part of
it. So your medical journey is awe-inspiring, and I will keep saying that. And that's not a compliment. It's really just the objective truth. So on that note, if you could just share with us, Tolu, your journey from Nigeria to Mount Holyoke to Tuck, what inspired you to get into this complicated, long-winded path of becoming a doctor?
Yeah. So I think my path to America actually started probably when I was 8 years. I read a book, and I remember it was an autobiography, but it talked about conjoined twins, and in the book it described a surgery that separated conjoined twins. And I remember looking at the pictures. I don't think I fully understood what was going on in the surgery, obviously, but I was like, oh, I kind of want to do that, and this person did it in America, so I'm going to go to America. And that was kind of how basic it was, really. And then through, we call it secondary school, so in Nigeria, but I guess the equivalent in the US would be middle school and high school. I did a lot of science classes. I've always liked writing, but I think I've been kind of science heavy. And so I thought, well, I'm going to do that thing I was going to do at 8. So America, yay. And so I applied to college, and then college applications were really the first time that I started reevaluating what I wanted to do. I'm like, this is silly. You opened a book and saw something at 8. You should think about other options. So I played around with different other majors. The college application, like you said, or the process led me to Mount Holyoke, which before coming to the States, I actually didn't realize there were women's colleges. I thought, wow, okay, I don't know how this is going to go, but I loved Mount Holyoke, go Mount Holyoke. And Mount Holyoke was a really special time for me because I think it gave me time to look at my different interests. So again, harness or develop the science part of, my education, but also I got interested in theater and poetry and writing and history. I really fell in love in, especially African and African American history in college. So I've always been someone who has different interests. But I think one important part of my story happened at Mount Holyoke, and that part was when you leave, or when I left my home country and came to the US, I don't think the culture shock was as big of an issue as people initially think. But I think what was more important was just a sense of duty. I had a lot of time to reflect about where it was from, what it meant to be from Nigeria, from Africa, and if or whether there should be a duty on my part now that I have left to do anything about it. And I just felt that strong sense. My coming to a strong sense of self included Africa in a very strong way, and that happened in college. And so everything I did from the internship, so I worked in Uganda in college in an internship with a nonprofit there, and everything I did was every question or every experience, I always asked, how does this relate back to home? How does this change where I come from? I think I carried also that question through medical school. And the reason I eventually decided to do medicine was because, yes, I'm very fascinated with the human body, and I love, how small things come together to make big things, and then you have a human body. And, when disease comes in or sickness comes in, those things break down. And the fact that in medicine you had the knowledge to at least try to do something with that was amazing. And I think medicine is also one of those fields that has international reach, right? Because there are humans everywhere, there's sickness everywhere. And so again, with that vital question of how does this translate back home, medicine was important for me for that reason. And so I applied to medical school, got into Dartmouth, loved Dartmouth. But Dartmouth also had a beautiful opportunity to do this MBA program. And it's something that I started considering in between college and medical school. So I've taken a year off because I'm someone who does well with gaps and breaks. I don't like to do things straight through. And so I was working in research in a neurology lab at the Beth Israel in Boston. And for some reason, I started thinking about systems and the ways we exist, in systems, and thinking about the healthcare system here in America, but also back home in Nigeria and also on the continent, African continent. At different times, I'm going to say the continent because in my head, the first continent is Africa. So I'm just going to say that up front. And I started thinking about, the question that had come up in college when I was in Uganda about how healthcare problems don't just happen in a vacuum. There's a whole host of socioeconomic factors that play into health, and sometimes even more than biological factors. And so my interest in the MBA was actually saying, can I learn a different language? Can I gain a different skill set that will let me speak to some of those socioeconomic factors and have more of a holistic approach to solving problems? And so Dartmouth had the combined MD MBA program, which is one of the reasons I chose them. And it was, I think, Tuck, which is the business school I went to, Dartmouth's business school, has been one of the best decisions I've made in the past, 5 years, 6 years. And again, because I have a new skill set and a new way of looking at things that I didn't before, and a new confidence that comes from having a network. It comes from having new skills. And I feel like I'm one step closer to just answering those questions of how is what I'm doing here right now going to translate to a better Africa, a better Nigeria, and hopefully a better world in general. So long-winded, but yeah, that's the path.
No, I mean, there's so much to follow up on there. Tolu, what would you say? In my line of work, I work with physicians, so there seems to be a hesitation, at least my read has been, to go into the field of healthcare, especially with the challenges that I'm sure you're very well aware of, and both the policy and the structural system in the United States, as well as in the path, the medical education path. So what would you say to the woman, the student who's thinking about starting this career, but is shying away from both the challenges in healthcare policy in the US, as well as maybe the uncertainty that comes along? And I know you've written a lot about support and how important support is. I've looked into the articles that you have. So what would you say to the young mindset that's uncertain as to whether or not to embark on that path?
I would say spend some time finding out what your question is. What's that problem, the one problem you want to fix? And I worked in the bio you read, I worked at a school in South Africa, African Leadership Academy. It's not quite A levels, but it's kind of after secondary, after high school. It's a 2-year program just before you go to college. And one thing I really appreciate at that school is that they ask you to pick a problem in the world you want to solve. Mm-hmm. And I think when you have that problem in mind as opposed to a career path or a job, I think you're able to think a little bit more critically or a little bit more holistic about how you get to that problem or how you get that problem solved. So I said that to say is sometimes people say, oh, I want to be a doctor. And what they're really saying is I want to increase access, of insulin to people who have diabetes, right? You don't have to be a doctor to do that. And so I find that a lot of times I find myself kind of wondering if I'm counseling people away from medicine, because I think if a lot of people spent more time upfront thinking about what they wanted to solve and all the options they had to get there, I think we would get to our answers and solutions much quicker, much cheaper, much cheaply, with less debt. And I think people will be way more satisfied. So that's honestly, it's not a direct answer to your question, but I think I would say, think about what the problem is you want to solve. Talk to different people who are in some way, tangentially or not, involved in, that problem, and then see, what fits best, as opposed to just saying, okay, I'm just going to go to medical school. And that is not a direct answer to your question, but that's kind of what I'm going to say.
Oh, it's actually a very interesting way of putting it. I think a really helpful way, because oftentimes we hear about, identify the problem before you want your solution. That's the way entrepreneurs think. But to think about your career in that format, I think that's really innovative. That's really creative. And I'm going to start thinking about it in that way myself. It's truly, it's thought provoking. And I guess as we're talking about problems and policy, how would you, or have you started maybe drawing parallels between the challenges and the loopholes you're seeing in the system in the US versus in more resource deprived areas of the world, be it in the African continent or in other systems that you've assessed? And I guess how should we be thinking about that, especially with the pandemic really shedding light on the issues over here in the US?
Yeah. One it's a really good question. I think it's a hard question to answer, but one thing that comes to mind is the concept of, we keep building new hospitals and building larger buildings. And in a time like the pandemic, yes, this is important, but I think when times are calmer, it's less important to have big buildings and larger corporations or hospital organizations. I think it's more important to focus on what people are doing in their homes, focus on preventative care. And so I would say, drawing a parallel from, how America is doing in, other healthcare systems abroad, I would say focusing less on the big flashy things and saying, what are the things, how can we, and I don't really like saying the sort of empower people, but like, how do we, because I think it's trite and people use it too much, but how do we, again, it goes back, what's the actual problem, and what's the closer solution to that problem? And so it's not building hospitals, because then you're just building hospitals because you're waiting for people to get sick. Right? So how do you prevent that sickness, and what are the how do you look at, again, talked about socioeconomic factors, if there's a certain group that is overrepresented in your hospitals, why? Like, ask those why several times. And so I think a lot about, Nigeria has an interesting healthcare system. It's growing, and I think in many ways we're copying some of the mistakes that America has made. And so I think about this a lot, especially, again, with the example I put forward. But I think with developing healthcare systems, it's looking at, okay, who's the population exactly? What are our needs? And what are the grassroots, in a sense, solutions to these problems, as opposed to building larger buildings or, larger insurance companies or whatever. And I also think that it's interesting that now consumers are becoming more, driving healthcare a little bit more, in terms of whether it's, doctors being graded on patient satisfaction, or, So or with the advent of, cash-based healthcare and like minute clinics and things like that, you're having patients be able to choose how much they're willing to pay for a service. And in some ways, it puts physicians and healthcare workers' salaries and money like on the table. But I think it pushes us to really think about the services we're offering, pricing, even like price transparency, for instance, is something that has been debated a lot in healthcare here. And I was trying to look into some of the devices we have here in the hospital, and it's just hard to find an actual price. But if people are able to find, okay, this is exactly what this costs, or this is what I'll be billed, then you can make those informed conversations or discussions with yourself about, do I go to a hospital A or hospital B? What kind of outcomes do they have? And I think even though it cuts into the bottom line of the hospital and the healthcare, the provider side of the healthcare system, I think it'll push us to provide better care and more value with our care. So I've said a lot of things there, but that's it. Yeah.
No, it's interesting that you said on your point about maybe Nigeria copying some of the mistakes that the US has made. And that's definitely been my sentiment from my country of origin. Azerbaijan, where we're just building hospitals, but when you look at the level of care, there are big question marks that emerge. Yeah. How do you think, and this is a big question, right? But what do you think are the right steps in terms of overcoming that copy-paste approach? And I know you're part of All for Health and your African advocacy, as I said in your introduction when I was reading about your work, it's a huge part of it. So how are you thinking about it, as next steps and going forward? In terms of what meaningful care actually, what that looks like and what it means?
I think for me, I'm currently being trained as a physician in an American system. And in some ways, medicine or medical training forces you to be one thing in a sense and to learn one way and to get comfortable with one way. But I think thinking about like health systems back home, especially in Nigeria, I think I'm trying to prepare myself to be uncomfortable. And what I mean by that is, what are the ways of providing care that I haven't thought about, that I wasn't trained in, that are better for patients, that maybe don't include me as a highly skilled physician? And so how much of my power as a physician, as a US trained physician, am I willing to relinquish in the fight or in for the good of better healthcare? And so I would say being uncomfortable to I think it's important for me, someone who's interested in African healthcare systems, to actually spend some time in these places, my home country, other places, and actually practice and see what are the pain points. Because I think even though my intentions are very well-meaning, I've been here for the last 12 years, 11 years, right? And so I've been trained as an American doctor, and there are a lot of Americanisms that hurt people because they're untrue or because they're paternalistic. And so I think uncomfortable in the sense that you go back and get used to how people do things and also learn. I also really push back against the idea that, education or health information has to go one way in one direction. So from the West to the global South or whatever. I think there are very innovative ideas, especially in the tech space, that are happening on the African continent, that I think can actually be adopted in the US and in the West. And so I would say making sure I'm open to seeing possibility or potential where it's just growing. And again, being comfortable with changing the way I practice and the way I look at my healthcare. So this is just personally how I'm dealing with or how I'm planning for a future hopefully as an African healthcare leader.
Totally. And just out of curiosity, do you have a sense of what that maybe introduction of those new technologies looks like on the African continent? Are these completely new medical devices or platforms and software that have not been tested per se in the West, or how would you define those?
So I think a lot of them are mobile-based technologies, and mobile phones are huge on the continent. I mean, everywhere, but really in Africa, they've infiltrated every aspect of life, and I want to say even more than they have in the U.S. I would say something like online banking and paying bills. I know we pay bills online, but there's a certain innovation that's going on in the African continent, even reaching like people who are unbanked. And in the informal sector that isn't harnessed here. I mean, most people are kind of on the grid, in America, but I think there are certain parts of mobile banking that I think are way more, in some ways, sophisticated on the continent than is here. So a lot of these are just companies that are using what people actually have in their hands, which is mobile phones, getting information out there. I have a friend who used to work with a company called Life Bank, and what they do is it's kind of a logistics company for blood. And so realizing that different hospitals might not have all the inventory for blood products or for oxygen supplies, they act as that logistics company that figures out who has blood, who doesn't, and directs people where they need. They've started, this drone technology of delivering blood products through drones or testing that. Again, in the U.S., you don't have that. Usually, you go to a hospital, you expect blood. But I think a lot of the need in Africa, on the African continent, is actually driving kind of really smart, really innovative ways at surfing those problems. There is another company used to be called One Health, but it's called Helium Health now. It's very interesting. My friend actually runs it with a couple of his friends, but initially started as an electronic medical record for hospitals, but now they're doing a lot of work or they started looking into lending to hospitals. And so it's very interesting. So that's what I mean. There's a lot of, whereas in America, you have a lot of siloed systems where you only do one thing or you're only interacting with one customer, which it simplifies things. But I think there's a lot of combination and synergies, I guess, that you can take advantage of that maybe in the US, because of how big things are here, we're not able to do as easily or pivot as easily.
And I guess this just naturally leads into, just for All4Health, tell us Tolu a little bit more about this, and how are you leveraging your experience in the US, your connections and your partnerships into that organization? And if you could tell us a little bit more about its work.
So, AL for Health is the ALA, African Leadership Academy's health network. And so the ALA wanted to figure out, how do we support our alums who are interested in healthcare, and how do we help them build out their careers? Most of them, their oldest alums are probably in their 30s, late 20s, 30s, early 30s. And so they brought me on kind of on a consulting role to figure out how do you connect these people. And I think communication and connection is so important. It's something that business school has also stressed for me, just like who you know. Even in medicine, people think medicine is all merit-based, and it is, but there's a lot of doors that open for you just from knowing someone, or sometimes even just having the right school behind your name, for better or worse. And so I think, so I kind of created AL for Health as a way to, how do we get these smart people all over the continent to start talking to each other, or make it, I shouldn't say start talking because they're already talking, but how do we facilitate that? And so where it's still, I was in the inception phase and kind of birthed it in a sense, but I've passed it on to a really, really wonderful group of people who are now leading it. So I'm more of on the board, the advisory board for the network. So I would say the main goals of that was really connecting and facilitating those ideas. I think Africa is full of brilliant people with innovative ideas. They need resources, they need mentors. And for me, on my part, I've been, again, building my own career here, but also looking out to, what are these ideas I hear? And are there people that might be interested or might be resourced enough to fund those ideas? And also for me, I tend to think of myself like I'm still building my own career. I don't know how much I have to offer, but I've been very honored to, have people who are still just starting their journey kind of ask me questions. And it's amazing because you think you don't have any answers, but you're just from sharing your own experience, just from sharing my own experience, I feel like there's some value in that. So my role in the network has been more connecting, sharing, storytelling. I love stories, and I think by telling stories, we're speaking to life in a very fundamental way and also making possibilities happen. So yeah.
No, it's amazing. And in terms of facilitating those connections and bringing the resources to the right places, how, and this is just for our broader network and for the audience out there, for those who would like to help maybe facilitate or more introductions or have work that is off the top of my mind, there are actually a few companies that are looking to do work in the continent. How do we go about that in terms of reaching out and contributing?
So there's the former manager, her name is Dr. Ayobami Oduton. She was very instrumental in getting internships. So one big thing about the network, and I created this in a way that it looks at healthcare in a very broad sense. So you're dealing with healthcare finance, you're dealing with clinical care, you're dealing with public health, manufacturing, drug manufacturing, device manufacturing, and thinking about the whole ecosystem. Because I think we have to, if we are to get anywhere in healthcare, we have to kind of develop all these things out at the same time. And so I would say, one, if we can think broadly about healthcare, and if some of these companies are willing to take on interns, or paid full-time positions where you're building capacity and training people in the different healthcare subsectors. And so you could, if they're willing, they could reach out to, the website is, I feel it should be AL for Health, I think it's .com, I'll check again. And if there's an email, there should be an email address to contact. And so if they have internships, whether it's virtual internships, in this day and age, I think that's what a lot of them are going to be. But virtual internships are great. If there is an idea like a hackathon or something, we've tossed around some of those ideas as well, or like a fellowship where the fellows can rotate through different companies and maybe produce a project or produce an idea afterwards that one of these companies can take on. So that's one big way, I think, contributing to companies or organizations can contribute to building capacity on the continent, building the AL for Health network. And again, just if there are resources, making them known so people know how to apply and things like that.
Super helpful. And Tolu, just thinking about your experience at business school, and that's always, I'm sure, a question that's being asked to you is, should I do a dual degree? And you're probably telling them, well, think about the problem you want to solve. But how instrumental has the MBA program been in terms of building out Ill for Health and actually in facilitating that network and connections? How important do you think it has been in that regard?
I'd say it's been crucial for me. And the reason I say it is because I would not have gotten that internship if I was not an MBA student, because one, it was an MBA internship. And two, I didn't think, before I did the MBA, I didn't think I had what it took to do a consulting project. Now, it's for anyone who is thinking about, do I do a dual degree, do I just do an MBA? I will say most of what you learn in school, you can 100% learn on the job, right? And so I'm not saying you can't get where you need without getting that degree,
right?
But the credibility that, your degree gets you, for better or worse, whether that means anything or not. That's how the world works. But I think for me, it was a way to just quickly learn some of the tools of the trade, learn the language. Again, language is crucial. In medicine, it's crucial. In business, it's crucial. Once you're able to say a few words, people think you know what you're saying, and the door is, at least your foot is in the door. So I'd say those are the two reasons that, plus a network. I have friends in almost every industry now that I can think about. And so I approach problems with a certain confidence, knowing that even if I've never done this before, I can quickly text somebody and say, oh, I'm interested in this. And can I, is there someone I can talk to? And so the networking, or the network I have now, the confidence, the actual skills, and the credentialing behind my name, I think has made the MBA an absolute, tremendous, wonderful investment for me. And so I would say, if you can do it, go ahead. If you don't mind being in debt, or you can pay for it, go ahead. But I would say, I wouldn't. AL for Health in the current form would not exist if I didn't go to business school.
And how did that work? Did you apply for your medical degree? Did you apply for the dual program altogether, or did you start your medical program and then apply for the MBA?
So I started it, and I'll be very candid here. I don't like applications very much. And so I didn't want to do 2 applications when I started. So I said, well, I know I'm interested in the dual program, but I'm going to just apply to the medicine program first, and see if I really want to do it, and then apply at that point. So it's at least 1 application at each time. And so I started medical school, and then took some business school classes while in my first year of medical school. I knew I still wanted to do it, and then I applied to the MBA program. And it's your full MBA program attendee, like the rest of your classmates. The only thing that's waived, or that was waived for us, was the 5 years of work experience that most schools want you to do. I still had to take the GMAT and achieve certain scores, things like that. So how it works at Dartmouth is the first 3 years you're in medical school, the 4th year you're just a business school student, and then the 5th year is smushed, in the sense that you're kind of in 2 places at one time. Partly because the 4th year of medical school has a lot of elective time, a lot of space, because people are applying for residency programs or doing some elective. And also business school, on the other hand, also has interview time, and a lot of the second year is also elective. And so they were able to smush those 2 years, in a sense, together. So it was a 5-year program, but I got 4 years of medical education, in 2 years worth of my MBA education as well. It works differently in some other schools. Sometimes it's just a year extra, like 1 year MBA. But for me, it was more or less a 2-year program.
I mean, this is probably a very simple question, but how, I don't want to say how challenging it was, because obviously, I mean, all the workload, it must have been very difficult. And again, I'm sure you're asked this, but in terms of time management and, maintaining your focus and, maintaining one, the medical program being obviously very difficult, and the other with the business classes being relatively difficult, but how does that go about with time management? And again, that's something that also pops in with any dual degree programs when you're thinking about doing that. And would you maybe suggest to do the medical program and then do the MBA in general? How should people be thinking about stacking up when they're thinking about dual degrees?
I would say if you could do it together, do it. Because there are very few times where I was like taking medical school classes and business school classes in the same week. So there was some level of segregation, if I could call it that, of those two worlds, at least within a week or a month period or things like that, or sometimes a whole year. And so for that reason, it was good to take a break from medicine sometimes, and, you know, look at things through the business lens, and then, you know, put that down and, you know, look at things through the medicine lens. And the reason that's important for me is because I think it was very important for burnout or reducing burnout. Because again, I'm someone, like I mentioned earlier, I like gaps, I like breaks. It's good for my brain and just my well-being in general. So I'd say if you can do it together, there's a kind of rest that comes with being able to switch and take off one hat and put the other one on. If these are both things you're interested in, it's different if you're kind of slaving through both. But yeah, so I would recommend doing it together. Also, I think the longer you put your dreams off, the harder they become to do, because the opportunity cost gets, you know, bigger and your energy is lower sometimes. So I would say just do it together if you can.
And in all of this, you've also authored a book. So, yeah, tell us a little. I read the summary, but for the audience, tell us about the purpose, the mission, and how you also found the time. And it seems like the way that your mental breaks are actually being resourceful to society, which is fabulous, but and immersing yourself in poetry and in writing an entire book. But tell us about Human and its mission.
So the anthology is called Human Voices of Tomorrow's Doctors. And it started really from a place of stress for me. You talked about support and things like that. When I moved to medical school, I had moved from Boston where I had a really strong connection, a group of friends, and I moved to New Hampshire where I didn't really know anyone. So the first 2 years were really challenging. And so poetry for me was a form of catharsis and figuring out, and also just reflection as well. And I still journal, I've always journaled from my teenage years, but I didn't have the time really to sit down and tell my journal my feelings really. So poetry was a way to quickly get out how I was feeling, and it was also easy to share. But the more I shared my poetry, I realized that many people were dealing with some of the issues of isolation, some of the frustrations of feeling like you signed up to be a doctor, and in your head you thought that meant something, but in reality it meant something completely different that was way less sexy than what you imagined. And so really, and again, because I'm not from the US, my view tends always to be more global. And so I thought, how can we get this conversation going across the globe about what it feels like to be in medical training, and really talk? Because in medicine, you know, everyone wants to be, or there's the myth of the infallible doctor, or the doctor who is invincible and can do anything and can go as long and as hard as they want, you know, taking care of other people and putting your own needs last. And so I started kind of reaching out to medical school deans and professors saying, I want to hear how your students are doing. Also, this is in the backdrop of knowing that 400 to 500 physicians in the US die by suicide every year. So you're taking care of people, but you're hurting inside. And part of it is because it's taboo to say you're struggling in medicine. So that's the premise of the anthology. And sometimes I'm very quick to add that I didn't author the whole book. So it was an anthology of reflections, both poetry and prose reflections from medical students and residents around the world. And I have some of my work in there, but I edited it. So it's not like everything is my work, but I'm very proud of it. And came out in September 2019. And yeah, I'm definitely very proud of it as well.
No, I feel like that, you know, a similar anthology or a similar type of work is necessary, maybe across professions. Just going back to my school years and thinking about the isolation, whenever you choose, be it the major or a specific degree, you feel like you're married to it, and then in a way you feel stuck.
Yeah.
So maybe as an inspiration to others who are thinking about sitting down and writing or putting together similar work for majors and industries across the board. Tolu, I want to actually ask you a little bit more about COVID from a global perspective, right? I mean, we're seeing the way some of it is very much politicized in the US. some of this, I've been doing interviews with doctors. I'm hearing a range of everything from diagnostics to therapeutics, so many varying opinions. So, what is your take on, from a global perspective, especially when we're thinking about Alpha Health and your work? Has it hurt? Has it contributed? Do you think it's given rise to opportunities for collaborations and partnerships, or what part of it is maybe hurting that type of work?
I do think so. I would say most of my work with regards to COVID has been mostly involving the U.S. Just because right now I'm in training as an anesthesiology resident, so my training has focused mostly here. But I do think that there has been a lot of collaboration, especially with in countries where they're not as heavily resourced. I think when you don't have as many resources, you rely on people a lot more. And so I think in what I've read about what's been going on in African countries, I think there's been a lot of talk about, one, our previous experiences with outbreaks like Ebola, for instance, and using historical data on how to handle pandemics, or, well, we have not really a pandemic, but epidemics, or outbreaks, smaller outbreaks like that. And using that to our advantage. So I actually think some of the successes initially and even now that a lot of African countries have witnessed has been because I don't think people give credit to how much more prepared in a way, or prepared we as Africans are in certain outbreak conditions, just because we've seen them more recently, and more frequently, which is a bad thing. But I think we have some infrastructure that makes it familiar enough and countries are small enough, in a sense, that we can mobilize quicker. Now, there are obviously problems, and I don't want to paint it as, we're doing 100% well, but I think there are examples where in certain countries, and I'm blanking on which countries right now, but in terms of testing, they've been able to get more tests out and results back to people more quickly. Again, it's a size thing, but I think it's also collaboration and realizing that you can't afford to have thousands of people die, or you can't afford to wait till they're super, super sick before you do something about it. So I think, speaking to the US, something that the US can learn from African countries is, again, just going back to the preventative side of things and saying, we can't wait till you can't breathe and you're on a ventilator. Again, masking, hand washing, those basic things. And I think the basic things, which are the unsexy things, are often the life-saving things.
Well, at least that's ending on a somewhat of a positive note. So that's great to hear. So Tolu, just lastly, any last words to students that are in med school right now or thinking about entering this field?
Take care of yourself. Don't lose parts of yourself that are important just because you feel like being in this field means one thing or means only one thing. There's so many ways to be either a physician or to be in healthcare. So I'd say take care of yourself, listen to yourself, listen to what's tugging at your heart, and pay attention and see how you can follow those tugs, but also make your other dreams come true. So I'd say you're more multifaceted than you think and that other people think you are.
Tolu, thank you so much for those beautiful words and for the amazing insights that, again, as someone who's not in medicine, I think there's a lot that I took away for my own career progression. So thank you so much. I really appreciate it. And to the audience, please reach out should you want to be connected with Tolu. I'm putting you right in the spot. But should you have questions, please by all means connect. And Tolu, thank you again. I really appreciate it.
So much. It was a pleasure. Okay. Take care.